Hello, viewers. You're welcome once again to Let's Talk Health on DS Online TV. Today, we're going to delve into something very important. Each time you say, I love you with all my heart, the French will tell you, je t'aime de tout mon cœur. Well, today we're going to delve into the health of our hearts, cardiovascular health. This has the world record has it that it's the number one cause of death worldwide globally. So it's a very key thing that we all need to look at. Whether it's for pumping blood or for loving somebody, today we'll tell. To help us digest this all important topic is no other person but our own Doc Victor Loglo. Doc, you're welcome.
Hi. Thank you.
How you doing?
I'm good. How about you?
I'm doing great. Once my heart is pounding, I'm good to go.
That is only if it's a normal pounding.
Hey, so there's even an abnormality in that one too.
Oh, we will get to know. We'll see by the end of today.
That's great.
Yeah.
Today we want to delve into the health of our heart, cardiovascular health. First one, people say that I love with all my heart. Does the heart love?
I mean, I wonder. I mean, if we really wanted to talk about our heart, or rather, it was the brain.
Okay.
No, I mean, there is no connection with the emotions and feelings you talk about to your brain. Even though we have the result of love, it can have a problem on your heart.
Okay.
We actually have a condition called broken heart syndrome.
Okay.
Like, is this a medical term? Broken heart syndrome.
Oh, whoa.
And it was found by a Japanese. So it's called Takotsubo cardiomyopathy.
Please, I'm not good with names. I don't want to
So
go
it's
there.
possible to have your love connected to your heart. However, I think what people normally want to say whenever they say, I love you from all my heart, is they meant to say, I love you from my brains.
Okay. Anyway, so today we want to delve into cardiovascular health. When we say cardiovascular health, what does that mean? Can you just make it, as you always say, in simple terms for the layman to understand?
Thank you. It's always a great pleasure to be here.
Great.
Yeah. So cardiovascular health is very simple. Cardiovascular. Cardio means your heart. Vascular means vessels, okay, or blood vessels.
Okay.
Actually, for our overall well-being, when you see a human being walking, running up and down, what that single unit, that ensures vitality, that ensures, the strength that we see is the heart.
Wow.
Yeah. Without the heart beating, there will be no push of blood to the body organs.
Okay.
Without the heart pushing the blood to the organs, there will be no oxygen. Without oxygen reaching them, they would die.
Okay.
So there have always been this argument, of between the heart and the brain. Which one is the most important?
I would say the brain.
The brain?
Yeah,
Why do you think so?
Because that's where all the things...
That's what the emotions.
Now I'm confused.
The love, the feelings.
The Bible says all things come from the heart. So now I'm confused myself. Let me leave it there like that.
There have been so many arguments. People say heart transplant can be done, and the person will still be alive around the time they are taking the heart, replacing with another heart. Forgetting that in that period, they have to, use an artificial pump to keep the body alive.
Okay.
Which means that there is still some pseudo heart.
Okay.
We have children who are born without brains. And yet because they have a heart to blow
and they are alive.
Or to pump, and they are alive, even though they have we call it prognosis, their life expectancy isn't, that longer because they are not compatible with life that much, and they will still live around the period. But if you should take their heart out of their body, that is the end.
Wow.
So the heart is a very important organ. And cardiovascular health has become important because there is a growing incidence, of cardiovascular conditions. I mean, globally, cardiovascular diseases forms the number one cause of death.
Yes.
The number one cause of death. You can think about all the other reasons why you lost a relative or something, but go into it deep and you realize that most of the times it has something to do with the heart. Okay? Especially, we used to think that cardiovascular conditions, and I'll give you some examples: hypertension, stroke, heart attack. Okay? These are the most common, but there are others. But these three are the most common. We think that, they are for a certain group of people,
Yes,
people
we talk about who are aged.
Or somebody who is stressing himself all the time. Oh, you are stressing yourself too much. You see, you would die from heart attack. You would die, that's stress. So
when you have broken heart.
When you're having broken heart, but hardly do we think that even we who think that, we are okay, we are not under so much stress, we are not grown enough, we are just young people having fun, we don't think that we are at risk of heart conditions. But the research is showing that there is an upward, increment in the incidence of cardiovascular conditions. Currently, when you take Ghana, so let's look at the numbers in Ghana. A research, so we call this one a systematic review. They put together so many research that were done, on cardiovascular conditions in Ghana.
Okay.
So we call this the pooled prevalence, pooled, P-O-O-L-E-D, like a pooling.
P-O-O-L-E-D.
Yeah.
Okay.
Like
Okay.
Pooled prevalence, using all the research that have been done, shows that we have like 10.3% of people living with cardiovascular conditions. So in every 10, 1 person. Now, don't worry. Let's narrow it down to one of the conditions: hypertension.
Okay.
Hypertension. The record, from Ghana Health Service last year shows that
just last year,
just last
2024.
year, 2024 shows that 25%, about 25% of Ghanaians.
Whoa.
25%.
Quarter of us.
Yes, a quarter of us. So when you take 5 people, count at any point in time. Look at the studio. 1, 2, 3,
no,
4,
four.
5.
Not 5, 4.
Yeah, 4. Exactly.
4.
Out of every 4. Exactly. Out of every 4. Thank you for that. Out of every 4. So 1, 2, 3, 4. 1 person, he may be suffering from
hypertension. Mbano. Nigeria man will say.
Yeah. This is exactly what some patients do when you tell them that, okay, so they ask you, doctor, how safe is this procedure, this surgery we're about to do? And you tell them a certain percentage of people, do not have successful outcome out of it. Like, I'm part of the successful one.
Successful one. Yeah, minus my head.
It cannot be me.
Yeah, never.
I mean, yeah, but it's this scary, because the incidence rate is increasing with time. You won't believe if I tell you that out of this 25%, it's only about 65%. So, like, if you should take 10 people, like 6.5. Okay, so it's 7 people who are aware. So there are some 35%
that are not aware
that they have hypertension and they are walking around.
Whoa.
These are the people who only come to the emergency room with stroke, or they will come with some heart attack or some, and it can also cause kidney diseases as well.
You are kidding?
Yeah. But by the time of this discussion, you get to know, like, there are a lot of conditions that if you have an uncontrolled BP can result in. You see, so it's very important. There are so many young people, so the person was fine. I just spoke to him yesterday, and then he slept and didn't wake up. But he came to the workplace, started complaining, my heart.
You usually say, my chest.
Yes, my chest. It's like, my chest. You rush the patient to the hospital, and that'll be it.
No, Doc, this is forcing me to ask a question that, how do I know that, because I'm just speaking for that 35% of that one, that quarter, who doesn't know that they have that condition. How do I know that, okay, so what is happening to me now, I'm probable to have
it or not?
Yes.
Hold on to that question. Don't forget this question.
Okay.
But let me blow your mind with another thing. not only do we have 4% people not knowing, even those who are having a condition, out of the 65%,
Yes.
it is only about 20% that are on medication.
That is alarming. That is alarming.
So somebody may not know, but even the one who knows,
it's not on medication.
there are a lot, like a greater number of people who are not on medication.
Like,
And those on medication, out of the 20%, there are only 6% who has achieved controlled BP level.
oh, wait, let's do this mathematics well. In Ghana,
Yeah, 25%.
25%.
Yes.
In that 25%, we're saying that
65
65 are aware of
Yeah.
their condition.
Yeah.
So the 25 is now a whole number.
Yeah.
And out of that whole,
Yeah.
65 are aware of their condition.
Yes,
The
exactly.
35 are not aware.
They are not aware.
Even that 65%,
Yes.
you're saying that
Only 20%
20% of them
are on medication.
are on medication.
Yes.
So that 45%, what's happening to them?
So
Then even with that
remember
20,
you are spreading it like this time around like a percentage.
Yes.
So you get it.
I'm getting
Yeah.
it. So even in that 20, you're saying that only 7% have it under control.
Control, yes.
So
So there are so many gaps. There are so many things.
that's serious.
But one important thing is knowledge. And that is why we need to talk about this topic.
That explains why the world has cardiovascular issue being the top
Most cause of our death.
out there.
Because there are people walking about experiencing the signs and symptoms, but they do not know that they have it.
Please go into it because
Okay.
sometimes I feel some pressing, something pricking my chest. I don't know whether it's my heart or what it
Okay.
is.
So, how do I know if I'm having a cardiovascular disease
Yes,
or not?
that's my question.
Number one, if you tend to feel palpitation from time to time, so this is the simplest explanation. Maybe it's a big word. Palpitation is a big word.
Oh,
so let
the
me
heart
try to
pounding.
explain it. Yeah. As we speak now, do you feel your heart beating?
I'm not paying
Be honest
attention
with
to it,
me.
so I don't know.
Be honest with me.
No, I don't know. I don't pay attention. It's something
Do
that
you feel
happens
your
every
heart
day.
beating right now? It's a yes or no.
No, I don't feel it.
Super. But the moment you start feeling your heart beating, that is palpitation.
Oh, okay. Now I'm safe. I've passed the first test.
So, when you feel that forceful beating of the heart, it's forceful beating of the heart. You are not supposed to. We are breathing. We are not feeling that we are breathing. Then when you feel that you are really adding some strength and some energy to breathe in and out, there's a problem.
Okay.
The same with your heart.
Okay.
So the moment you feel the heart beating, small time, you feel the heart beating, you're having a problem. You may be having a problem. And you need to get to see your doctor. That's
Okay.
number one. Number two, sudden onset of chest pain. Okay? Chest pain. There can be other causes. It could be ulcer and all that. But you feel that, no, this chest pain becomes severe when I start doing a work, like running around, walking, lifting something, climbing the stairs. Then suddenly you feel that chest pain. But once you relax from the work you are doing, it relieves you. You should know that there's a problem.
Go to visit your doctor.
You should see your doctor. Number two, you get tired. Number three, you get tired easily. Do something small. I'm tired. You're panting for air, panting for air. It tells you that the heart is not able to deliver adequate blood.
Oxygenated blood.
Oxygenated blood to the body as required.
Okay.
I mean, there could be a problem with the heart. Or there could be a problem with the vessel through which the blood is supposed to be distributed to the organs.
Okay.
And so that's why we say cardiovascular, cardio, heart, vascular, vessel.
Okay.
So there could be a problem with the vessel or a problem with the heart.
Okay.
So easy fatigability. You get tired easily. You do something small, you get tired. And then having difficulty in breathing. Like I told you.
You're scaring me.
Yeah, we breathe normally, but the moment you see that, no, this one, you're having difficulty in breathing. And it comes in many forms. Number one, when you have difficulty breathing when you are lying down
Okay.
on a flat surface, so that you need pillows, not just a pillow. You require like 2-3 pillows.
To open the air passage or what?
Yeah, I mean, you forget about what is happening, but just think about like holy. Anybody, if you have to require 2-3 pillows to sleep, or else you are going to have difficulty in breathing, it tells that there is a problem with your heart. So this one is with lying flat.
Okay.
Then we have those that they will be sleeping normally. However, midnight, it will wake them up with breathlessness. They just wake up because they cannot breathe. They feel like they're dying.
They're gasping
So
for
they're
air.
gasping for air. So they have to wake up, sit up. And when they sit up, they feel okay. You have a problem with your heart. And then those who have both legs swollen. So not just one, but if you have both legs swollen, sometimes you see that the person gets both legs swollen. Having a heart condition, you may be, remember the word,
Yes,
it's not
may.
absolute in medicine, but it's an important sign. Once it tells you that there could be many other, once you have both legs swollen, think about heart, kidney, or liver. So once you had heart in it, the heart is an important thing. So that. Then there are, others like sudden collapse. Sudden collapse, weakness on one side. Those ones, by the time you start to have all these things, it's too late. But the initial things I've said, there are things that somebody may be having it on and off, palpitation, issues with breathing, issues with the chest,
So, the palpitation issue, it's some people, for no reason, I don't want to say they are scared. I just can't fathom. So those ladies, was just any little thing and then...
Yes, it could be panic attack.
Okay, that's a panic attack.
Yeah, that could be panic attack.
Issue.
That's or anxiety.
Okay.
Anxiety disorder. They are going through some anxiety about the future, about something, boyfriend.
Yeah, you know right.
Yeah, but the moment you are feeling something like this, still go and get your heart checked. Go and get your heart checked, because, like I said, the condition may be mental, it may be emotional, it may be something in the brain, but it will have a resultant effect on the heart.
Okay.
Remember the Takuchubo?
That big name.
Yes, the broken heart syndrome.
Yes.
It doesn't start from the heart, it starts from the brain. But that palpitation, that effect that the person is always having, it can end up affecting the heart.
The heart.
Okay, so this is how you get to know that, you have a cardiovascular condition.
I was saying something. Sometimes you just have some piercing. Something piercing you on the chest. Is it also a sign?
It could be. Hey. You see, it starts like that. Like I told you, it starts with the one that when you are having an exertion, if you are doing some activity that involves a little bit of, breathing and engagement of your muscles, because it means that need to be fed with the oxygen.
Yes.
So the moment you do those activities, so climbing a stair, running around, jogging, brisk walking, lifting something, the moment you are doing that and then you feel this pain, on your chest. But when you stop, it gets better.
But what I'm talking about, you are doing nothing, you just, all of a sudden, you just feel the pain, and sometimes you I don't know, you want to hold it.
Yeah. It can be anything. It can be anything. When you look at your chest over there, if you were breaking through it if you were cutting through with a knife, first thing you see is your skin. Under the skin, there are muscles, there are bones, there are rib bones before you come to the heart. And under the heart, the stomach is just right there. So it could be a problem with the muscle, because of maybe you lifted heavy metal or you lifted something. Problem with the muscle. Could be a problem with the bone because it hits against a wall or there was a high impact somewhere. Or it could be a problem with the heart, which is our topic for today.
Yes.
Or it could be a problem with the stomach ulcer.
Okay.
So this is the reason why you cannot be certain. You just need to present yourself. Let your doctor get to know, okay, this is a challenge, this is a problem. Then, we find out a solution for that.
Doc, I'm visiting you tomorrow. Because this is quite scary.
Yeah.
In fact, for it accounting to, being the top reason why people pass on in the world.
And the rate that we're having young people are getting stroke like crazy. Yeah. And it can be anyone. There is something crazy about stroke. Anyone. We are all not immune to it. I mean,
Anyway, Doc, we'll be
I don't wanna
delving.
scare you.
No,
Sorry.
we'll be delving into those
Yeah,
topics subsequently.
Great.
So,
It'll be a great
as we
pleasure
start
to
in
talk
this
about
one,
that. Yeah.
so I want to ask: is there anything that I can do to either prevent myself from getting a cardiovascular issue, or if I already have, what do I do to slow down? I don't know if you can stop it entirely.
Yeah.
If there is,
Yeah.
if there's anything to do.
Okay, thank you for that question. Can we talk about the cause or the risk factors?
Okay.
And that is going to help to answer this question.
Okay, that's great. That's great.
Remember, we once talked about risk factors. So number one, just get to know that when it comes to the cause, there are different causes. But we don't have a specific cause.
Okay.
We don't have a specific cause.
You
so
always
why
say
somebody is having hypertension, there's no specific cause. However, there are risk factors.
Things that get you prone to
Exactly.
getting there.
Exactly. So I will always go back again and say let's not confuse causes
with risk
factors. Causes are direct. Once you had the thing, you are going to have the condition.
Okay.
But risk factors are conditions under which you have a higher likelihood. So once you're having this condition we are talking about right now, you have a higher likelihood, which means that if you can do something about not getting this condition or controlling the condition if you are already having it, then it answers your question.
Sure.
There will be a lower likelihood of getting a cardiovascular disease.
Sure.
You get it?
Let's deal with
Now, there are two classification or two broad, classification of the risk factors.
that. Okay.
We have the modifiable risk factors and we have the non-modifiable risk factors. The modifiable risk factors, it's just like it means. There are things you can do something about.
Okay.
You can. So if you are ready to do something about your life so that you can live long and not have to, go through it. It's every month people spend close to 500 cities, 200, 500 cities on coming for their renewal, BP medication renewal, BP medication. She kind of cry. I don't know what's in here. How much do we have that you are going to always going to vomit 500 every month?
How much is your salary?
How much is even a salary? How much will your children send to you? Because these are elderly people. So if you don't want to end up in this, then you have to look at the modifiable risk factors I'm about to mention.
Okay.
Very well.
You sure?
Now, so between the modifiable and the non-modifiable, which one would you like to
I'll
hear
prefer
first?
the modifiable first.
The modifiable first.
Yes.
Okay. So, number one modifiable risk factor is hypertension in itself. It's interesting, huh? Hypertension is a modifiable risk factor of all the cardiovascular diseases. It is a cardiovascular disease and it's also a risk factor because the hypertension on its own can lead you into all the other conditions. All the other conditions we are going to mention, like the stroke. Somebody with hypertension has a higher risk of getting stroke, getting a heart attack, getting, pulmonary edema. There are other conditions, but they are not like commonly used outside there, but these two are commonly used. So hypertension is one of them.
Okay.
So what does this tell you? If there's someone with hypertension now, try not to be part of the 20%, not to be part of the 80% who are not on medication, but be part of the 20%.
Who on medication?
And when you're on medication, make sure you take it as prescribed. When you comply to it, you'll be able to achieve a control level. If not, you become part of the 94%, because remember we said it's only 6% who have control. So you
You said 7.
Yeah, it's actually 6.
Okay.
It's actually 6, yes. It's actually 6. That is so bad.
That's terrible.
Yeah, that's terrible. So hypertension is 1. 2 is diabetes. Yeah. So just having diabetes alone puts somebody at risk of getting a heart attack, especially women. Women has a higher risk of developing what we call acute coronary syndrome. So the heart attack, the one they will say, my heart. I tell you, it starts with the one that you feel the pain when you are doing an activity, but when you start the activity to stop. Then it will later progress into whether you stop or you don't stop, the pain will still be persisting. Then from then, the next level is where the person says, oh, my heart, and that is it. Die. So, like it moves in that phase. We call stable angina. Unstable angina, then
you're on the exit.
Yeah. So, diabetes is one.
Okay.
And it can be controlled.
Okay.
Diet, medication with diabetes. So, then the other modifiable risk factor is inactivity, physical inactivity. Physical inactivity.
Again, no.
Yeah.
Again, no. From the first time we started meeting here, always talking about physical activity, exercise.
Yeah. So it's an important thing. I tell you what, it's a blessing to be young. It's a blessing to be young. Where we are right now, it's a lot of blessing to be young. But if you do not make good life choices, health-wise, you have a bad time in your old age.
Okay.
So it's very important, and we will talk about. We'll break down a little bit, and then obesity.
Wow.
Yeah, obesity. It's not a good thing at all. Obesity does not mean wealth. It doesn't mean you are living good, like the way the local Ghanaian or the local African.
Hey, you just reminded me. Last time I went home, my dad saw me. It's like, oh, Koku, my belly is coming. That's what he said. And I said, oh, these few days I've been stressed. I've not been exercising. He said, oh, it's a sign of good living. I listened to it. I was like, this man you don't know.
Oh, hail the rich man. After the interview, bro, you got to sign some check for me. I need
says who?
Yeah. So obesity is not a good thing. Obesity is you signing your death, warrant right away. So how do you know? You get to know by checking your BMI, your body mass index. Okay. Yes. You cannot just look at a person and say, hey, he's obese. No, you cannot do that.
Doc, hold on. So, viewers, go get the formula for calculating body mass index.
I will give a little help.
You give a little help.
Yes.
But anyway, go and get it, put it in the comment section. We're waiting for that from you also.
Yes, because I want people to go tomorrow and go get it checked, So it's very easy. Just check your weight and check your height. Okay, check your weight and check your height. Your weight first, so in kilograms.
Okay.
Normally the height they'll be measuring in centimeters, but convert it to meters and square it. So your weight divided by a square of your weight in meters.
No. Again, take it again.
Weight.
Okay.
Kilogram.
Yes.
Divided by the square of your height.
The square of your height.
Yes.
Okay.
So if let's say the height, normally they would have given you maybe 170, 180, 150, 160, whatever. But it's in centimeters, whatever you are hearing.
Yes.
The hundreds
is
in centimeters. But if you want to send it to meters, it's let's say if it was 168 centimeters, it will be 1.68 meters.
1.68 meters.
Yeah, divided by 100.
Divided by 100.
Yeah. Like divide the value you got in centimeters by 100.
Okay.
That will be in meters.
Meters.
So you square the meter.
Okay.
So
1.68 squared.
Square.
Okay.
So the weight divided by a squared of the height.
Okay.
In meters.
Okay.
Whatever the value you get, if it is above 30, you are obese. So obesity is a BMI above 30. There are actually, so before that we have underweight, we have a normal weight, we have overweight, we have obesity.
Okay.
Underweight is less than 18.5.
Less than 18.5.
Yeah.
And then
the normal is the 18.5, to 20.
20?
No, to 25. Sorry.
Okay.
25.
Okay.
Then we have 25 to 29.9. So you see, the normal weight is the 18.5 to 25. Normal.
Yes.
So if you find yourself in 22, 23, it's normal.
Okay.
But once it crosses that 25,
25.1
to 29.9,
okay,
you know that you are now in overweight.
Okay.
And many people, they find themselves in the overweight.
Okay.
But if you cross the 30, 30 and above, you are obese.
Obolo.
And you have a higher risk of cardiovascular conditions and then hypertension. In fact, we can spend a whole day talking about weight, it's one of the problems with infertility.
Yes, we mentioned that as well.
Yeah, PCOS. There's PCOS, polycystic ovarian syndrome.
Yes, you mentioned that during our
infertility
discussion
yes.
as well.
And sometimes the management is to just lose weight, and then your menses will come back. People 60 years of no menses, 5 years of no menses.
That is very true. I've been instructing, some time past I was instructing at the gym, and I recall a couple of ladies that I train. I think 3, 4, 5 days, then they take a break. They absent. You ask, you say, "Oh, I had my flu. Were you expecting?" He said, "No, just the exercise." "Oh, really?" Then I said, "Okay, I've become a physician. If your flu is not coming, bring the person. I'll let you flow."
Fantastic. Yeah. So that is it. I mean, obesity can cause a whole lot of problems.
Okay, so let's delve into the other ones, the other risk factors.
So smoking.
Oh, you are
smoking and alcohol. Yeah, smoking and alcohol. Now. You want to talk about?
Oh no! Just a friend told me that when you're in a medical school and they ask you for a risk factor or something, you don't know.
Yeah,
just write smoking and alcohol, and
you'll be right.
So it's a no-go area for everybody.
Everywhere. Now, when we look at the non-modifiable risk factors, things that you cannot do anything about, you can't do anything. One is your gender, and specifically a male. Male are 2 times at risk.
Oh.
Yes.
Oh.
So now I'm leaving it to you to tell me why male are at risk of getting heart attack.
First thing that comes to mind is that we don't like sharing our problems.
Okay. Interesting.
Yes. So we keep it to ourselves and we are thinking about it, and then, as you said, that big name, no? Then from the brain to the heart.
Oh,
and then
yes.
we keep it low. That's what I think. That's what's coming off.
Well, yeah, we are people of few words as compared to the other agenda.
They out there.
What else? What else? Cool.
I also heard that the male heartbeat is quite faster than the female. I don't know how to.
No. I mean, this question has got to do with clinical. Like, think about other social reasons why men are at a higher risk of.
The responsibilities are too many.
Responsibility, exactly.
As a man, you now marry somebody's daughter, you feed her, clothe her, house her.
Yes, even the one you just proposed the next day.
The next day is
Indomie.
Or more bill. Straight up, Indomie. If it's not Indomie, shawarma.
Yeah.
Pizza.
Semi-momo.
Oh my God. So
it's
now,
not easy being a guy,
with this economy, which is actually squeezing us, in fact, squeezing our balls. Anyway, here we are.
Yeah, and also men, we are adventurous. Okay. We like to do so many risky
things. Take a lot of uncalculated risks.
And so this, we live with it, later in life after we smoke anyhow, drink anyhow.
Do all the
things, driving and all that. We just want to always take that risk so that we are the men. And then we also have the cultural expectation of a man. A man does not cry. A man does not complain. Do it, obey.
Men don't cry.
Men don't cry.
As the Rastaman says.
Yeah.
Sometimes I cry.
So these things may, explain why men are at a higher risk. The other thing has got to do with a family history. Okay. So one way to know is that find out from your family members if there were anybody who died at a younger age of no cause.
That's what you said in the very first episode, unexplained death.
Unexplained death.
Yes.
Unexplained death. Now, research was done in Ghana to find out one of the most common risk factor of cardiovascular disease in Ghana. This is in Ghana.
Okay.
And they found out that divorce is one of them.
Oh, you are?
Yeah. So they choose divorce over marriage. Like, people who are married have a lesser. People who are married and people who are not married. But people who divorce have a higher. They have a 1.5.
My brother, my sister, stick to your partner. At this time, we need you alive. Your health is key to us. Stick with them. Once you divorce, Charlie, you just had that.
Another thing is age. That's the last one. Age.
Okay.
Yeah. So in men, it's earlier than in women. Men after 45 years, women after 55 years, they had a higher risk of cardiovascular disease after 55 years. However, in men, it's earlier. Men tend to experience it earlier, 45 years. Like, the whole odds is against men.
That's what I just want to say.
So now, what do I do?
Yes.
Okay, number one, behavioral change.
Behavioral change.
Behavioral change. Start from the mind. You have to, after knowing this, or the things we are about to say that you should do, you need to personalize it to yourself. There is no one way to do it.
Okay.
You have to look at which one you are good at, what you are not good at, and then you start to, restructure your life accordingly. And it's one step at a time. You cannot, hey, I'm going to exercise from today, boom, 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 and I want to change it all. No, you have to, take it gradually and build it up and make it your lifestyle. It should become a lifestyle.
Yes.
A smooth way of living it. So behavioral action. Number two, stress management. Yeah.
Charlie, some of us, I don't want to say that, but people are working at places and everybody has a lot of stress.
Everybody.
Related to work.
Yeah.
Everybody. Everywhere you're working, there is an amount of stress at the
and
workplace.
we always go to borrow people's stress. Somebody will be stressed.
No,
and then he
use that word again. You go and borrow somebody's stress.
Somebody said that the person will express his stress upon you, and you'll pick
Then
it up and
it.
then now give it to the next person. So people do not deserve how you treated them, but it's because of how somebody stressed you. So somebody is not having money in his pocket and is not able to take care of the wife or the children or attend to a certain responsibility, comes to work and is screaming all over the workers. And the workers get also stressed up and they start screaming on the customers. And then it goes on and on and on.
The customer
on
too
on.
got furious. How can you talk to me like that?
And give it
Go
back
back
to
to
you.
the wife and give it to her.
Exactly.
Then the wife on the children.
Yeah. And the thing is that, remember we made mention of the 4 P's.
Yes.
Predisposing, precipitating, the protecting.
Boy, don't forget everything now.
You can't forget. This medical school, you can't forget.
Yo, the protecting, I'm not forgetting about
yes.
that.
Somebody
yes.
may be okay if you scream on him or her, maybe okay. But somebody may be having the predisposing factor. There may be a family history of the condition. This person is a male, elderly patient. The person may be having diabetes, or the person may be obese, may be having all these things. And you express your stress on the person, that is what may trigger the person into developing a heart attack.
That's why somebody tell you are the reason why I'm having BP today.
Somebody's money got missing in their house. She claims the children stole the money. And that was it. She was screaming, my money. That was how she got a stroke. That was it. Guess what? I was told it was like 1,000 of... It was 1,000 cities.
1,000
Yeah,
cities.
she didn't make it out of that stroke. It was only about 3 months and she died.
Oh, she died because of 1,000 cities.
Exactly. So before you jump into stressing yourself over certain things in life, ask yourself, what is your risk? Because you may be just increasing your likelihood or your chances of
businessman will tell what's your risk tolerance level.
Exactly. So you need to look at all that before. You are better off saying, hey, I'm not going to stress myself about so many things in life, because when I die alone. The rest of the world continues. So risk control, stress control or stress management.
Yes.
Find ways to cope with it. It could be spiritual life. Maybe it's a prayer. It is listening to some music. It is about talking to one loved one.
Going out somewhere, giving yourself a treat.
Giving yourself a treat. Some people is sex.
Mention that one again.
Go for that, and then control your stress, and then life goes on.
Life goes on.
So that is 2. 3, your eating pattern. Eating pattern, and I will say it again: eating pattern, not just the food, but the pattern. You see, we have been so much into the components. You see, eat carbohydrates, protein, and all that. Yes, it's very, very important, but the pattern is even more important. The pattern.
Can you
eating late at night?
Okay.
Because this has become the person's pattern. And after that, just sleeps.
And they blame it on the work. Yeah. Where I work, I come back later. That's why I ate late.
Exactly.
Please,
so
you need to survive.
So this is why you have to appreciate that pattern will affect you. So now that you want to change, you have to now find ways that you can eat earlier if you know that you close late at work.
Okay.
Because you know that whilst you are doing that for the work, when you die, the next day somebody will come and replace you at that workplace.
They will replace you the next day.
Life continues.
Life continues.
So it's very important. The eating pattern is very important. Before you look at the component and all that, where we will tell you that limit salt intake, taking more hydration, taking more fruits and vegetables. When it comes to the fats, taking a lot of the polysaturated, than
Plant-based.
plant-based. In fact, there are some poly and monosaturated, fat foods like the fish. We have salmon, tuna, mackerel, granules. These are like really good, food for us, but not the. So I forgot to talk about one risk factor. Lipid, high cholesterol level. High cholesterol level. Yeah, they increase, your cholesterol. So there are certain foods. I think the last time I explained between the bad oil and then
you did.
The good oil. But when you fry for so long, it breaks the bond and becomes, a bad fat for our consumption. So that's for the food. We come to physical activities, and I'll say it again. It's recommended that you take about 150 minutes or more. So at least 150 minutes if you really want to keep up. See, this is the thing. You need about 25 to 50 kilocalories of the energy from food. To maintain your weight. Your current weight.
Yes.
So you can use the lower border, the lower margin. 25. Multiply 25 by your age. By your weight. That is the amount of calories you need every day to maintain your weight. That is there right now. So if you want to lose it, what about the value you got? You need to starve yourself at least 500 kilocalories a day. If you can starve the body 500 kilocalories a day, which means that if you're able to do this calculation and you look at the foods you eat, that is maintaining your weight and maybe add more. Now you know that, if I can cut and the pattern, if I can reduce the kind of eating that once you are done, you are going to sleep. And then you will eat according to what you are doing. The work you do determines the amount. Like somebody working in construction, the energy you need to do the work. So if you are going to do a lot of sitting, less energy demanding job, however, you are eating more than the 500 kilocalories in a day, you will only store the excess fat somewhere in your body, and the body will be, so why eat a lot at night when you are not going to? Are you going to run marathon at night? Are you going to?
We just want to cover for what we didn't eat in the day.
Exactly, and that's how you end up, gaining unnecessary weight. So that is it. And so the physical exercise, as we said, it can be indoors, it can be outdoors, like swimming, running, riding bicycle. And one of the indoors is what you are thinking.
I'm not thinking anything.
I mean, viewers, you know what he's thinking.
I'm not thinking anything.
And it's a good thing. Whatever you're thinking right now, it's a good exercise.
Please, I don't know what he's
talking
talking
about.
You
what sweat.
Is that?
And your heart, you feel, when you are done, it's like your heart is beating.
Please, I don't know what you're talking about. Yeah. I don't know. Yeah. Please come clear.
Your pastor is watching you. So yes, sexual activity is a good physical exercise. Yeah. So we have like levels. We have like low intensity, moderate intensity, high intensity. Research has shown that moderate and the high intensity helps to reduce the risk of having cardiovascular disease later in life. So we're talking about running around, using the skipping rope.
Yes.
We're talking about jogging. The low intensity one, brisk walk is also part of that. So the brisk walk is like you are walking at a fast pace, but you're not running.
Yes.
But it makes your heart beat a bit. Yeah, but that is a good heartbeat. And then the moderate one, which is also okay, like the low one, which is also okay. It's just strolling. Which I like doing a lot. Strolling, and sometimes I do the brisk walking. It's a very, 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 very good.
You feed your eyes a little as well.
Oh yeah, I do it late at night, so I don't get to see a lot. I get to now reflect upon myself.
That's great.
Yeah, and enjoy the silence. So, what else? Sedentary life, sedentary living. You have to cut down sedentary living. You just finish from work in the car and then now to the house, straight to sleep. The advice is that for every 1 hour of prolonged sitting, spend about 35 minutes walking around. So for every 1 hour, try and walk around 35 minutes. It helps to allow circulation.
That's why we take health break in workshops as well. They tell you to just take some 15 minutes health break. So when you are giving the break, just get up, take a walk.
And do it. It's for you. It's not for anyone.
Very necessary.
Yeah, and the last one is substance control. So between alcohol and smoking, remember, for smoking,
It's
our
a
advice
no,
is
no, no.
avoid it, like completely cut it. That is why you may need, if you are somebody who smoke, red, whatever, all the
Substances,
cut it.
Okay.
Then when we come to alcohol, you need to cut it down. Actually, alcohol is not like really bad, but there are like cutoff, to the units of alcohol you can take in a day. So in a man should take at most 2 units in a day, and a woman 1 unit in a day.
Doc, we will not measure that one today.
How do you determine a unit of alcohol? You don't want to talk about it.
No, I don't want to talk about it today. Last time young men came at me, I was like, Pius, don't talk about alcohol again. So please, the alcohol, limit it. Limit it. Oh, you know yourself. You know I'm talking to you. You know yourself.
Yeah.
Anyway, Doc,
Yeah. So that's it.
that's great.
Yeah.
Thank you so much. We really enjoyed this particular segment, and this is a wake-up call to all of us. And you have said that cardiovascular issue, it's not only with the aged. You have given us all that we need to know. I think subsequently we'll invite you to delve into the 3 most common cardiovascular issues: the hypertension, the stroke, and then the heart attack.
Yeah.
So we will be inviting you subsequently to delve into those 3 areas, so that we know how to really manage ourselves so that we can be healthy. Viewers, thank you so much for sticking and staying with us. You have heard it all. This is very key for us. Let's pay attention to our heart health. However, I'll leave you with this question. Doc had actually touched on it, and so I would tell you, put it in the comment section. The heart and the brain, which is more important? Is it the heart or it's the brain? Leave your comments there, and do well to click on the subscribe button, like, follow, and share. See you. My name is PIUS Athony. Bye.